Hello, my name's Dr. Vincent Mayer. I'm a primary care unit clinical director, assistant professor of restorative dentistry at the University of Pennsylvania School of Dental Medicine. Quite simply, flossing goes where a toothbrush doesn't go. There's food, there's plaque that's going to get in between the teeth. And if you're not flossing, you're not cleaning all the surfaces of the teeth. Probably the most common issue I see is the gums get very inflamed. They look puffy, they bleed. It is quite an unsightly thing. So there's a cosmetic element of it here too. Red puffy gums doesn't look good. In addition to that, chronic inflammation will eventually cause the tissue around the tooth to break apart. It'll cause the bone that holds the tooth in to withdraw a little bit. The teeth can get loose and you can lose them. But the most common thing that I like to relate to my patients is that inflammation for the body as a whole is a bad thing. I would say the mouth is connected to the rest of the body. When you have inflammation, in this case, chronic inflammation, if you have puffy, swollen gums, they're not going away. You live with them every day. The inflammation is there all the time. It may not be always hurting you, but it's there. Inflammation gives off chemical mediators that go throughout your bloodstream. These will harm cells. It has been shown to affect diabetes. Believe it or not, cardiovascular disease. There's studies now going on about heart disease and chronic inflammation, gum disease. Even, I dare say, cancer. There's research showing that chronic inflammation can really wreak havoc on the rest of the body, whether it's coming from the mouth or not. I recently read a study where they said treatment of periodontal disease actually prevents the clogging of the carotid arteries. So again, as I always like to say, the mouth is connected to the rest of the body. If you're flossing, you're brushing, you're cleaning the outside to the inside. If you're flossing, as I mentioned before, you're getting all the surfaces of all the teeth. So even if it's just food that's getting stuck in there, you're going to get the foods give off acids that can cause decay in between the teeth. A lot of times you don't see decay in between the teeth, and you think everything's fine until you get that toothache. So it's really important to remove that. What's worse, if you have a combination of gum disease and cavities, that cavity can start forming on the roots of the tooth, not the tooth itself. Getting decay on the roots of a tooth that's pretty much useless and the tooth has to be extracted. So it really needs to, you have to approach it from both ends. Quite a bit. It's actually, I compare all the time to if you go to the doctor and your doctor says you need to exercise, and everybody goes, yeah, I know, I got to exercise. People are the same way. You'll talk to them, and they're like, you're right, doc. They don't challenge you. They're like, yeah, I know I should floss. I just don't. What makes matters worse is that, like exercise, if you say, okay, I'm going to take up my doctor's advice, I'm going to start exercising, the next day all your muscles are sore. Same thing with flossing. If you have chronic inflamed gums, maybe they're not hurting you, but what are you doing with floss? You're going in there, now you're aggravating inflamed tissue. So for a few days, you're going to have acute inflammation. Your gums are going to be sore, and patients will call you and say, hey, this is killing me. What's going on? You told me to floss, and now it hurts me. So it's really important for dentists to, in advance, say, hey, look, when you first start doing this, your gums are going to be sore. But as time goes on, guess what? I always like to say they toughen up. But what you've done is you've gotten rid of the inflammation, the chronic inflammation. The gums get healthy, they attach to the teeth, they get pink, and they look better, and flossing ceases to hurt you. Hydroflossing, well, and that's kind of a controversial area in dentistry. There are some that say it's just as good. There's others say, well, it's not as good. Personally, I do both. I'm kind of in my senior years, and as you get to a point like you hear the term long in the tooth. I don't know if that's, clinically valid, but I do notice I have more space between my teeth as I get older. So what I do, I floss and then I use a water pick. And you'd be surprised some of the particles that come out. A lot of times flossing will loosen things, and then you go in and you use the hydrofloss or the water pick, and it'll flush some of the stuff out that you've loosened. So in my case, in addition to that, I use an ultrasonic toothbrush like a Sonicare or a Braun Oral B. So you're kind of vibrating all this stuff out of there. So if used as that's kind of a one unit, you can do a really thorough job. See, most of the patients I have that have issues are seniors. As you get older, you get arthritis, your dexterity is a little bit challenged. And so a lot of them simply can't floss. So that's, again, where I'll go in and I'll say, there are devices such as a water pick. Get a water pick, and you can get it pretty inexpensively these days, and use that in between. Get an ultrasonic toothbrush. There are also a lot of devices that I see interdental. They look like tiny bottle brushes that you go in between your teeth. Again, if you have limited dexterity, that can be a little hard for you. We also have floss aids, floss holders, floss aids, a little things you have floss that's stretched between and just go in with your hand. So even if you just can grab something, you can still floss. So there's a lot of aids, but I would usually most primarily recommend toothbrush, an ultrasonic toothbrush, and a water pick. Only that, over the years, it's just become part of my day. I try to do it in the morning. I have patients say, I do it before I go to bed at night. And sometimes if flossing is between me and my bed, I may want to choose my bed. So I get up, I get ready, I get showered, I get dressed, and flossing is part of my morning routine. If find a time that it's not going to be an inconvenience to you, and probably be a lot more compliant with it.